The good thing is that we now have the evidence of what works and what is cost effective in terms of accelerating progress towards achieving universal birth registration and legal identity for all. We know that over the last 2 decades, we have seen a significant increase in children being registered at birth. Just 2 decades ago, we had about 60% of all children under 5 years of age who were registered at birth globally. Now this figure has gone up to 77%, so we are making progress. We are on track. However, we also know that we have still some way to go. We have over 160 million children who are still not registered at birth, and about 230 million children who then, when we count also the children who never obtain a birth certificate in hand. So there's a lot still to be done. And we know that where we need to focus our attention to really shift the needle if we have any chance of really accelerating progress and achieving the SDG target of legal identity for all, including birth registration. We know that almost 1 in 3 children not registered at birth are in the African continent, so this is where we really need to focus. And we won't be shifting the needle unless we really pay attention to 3 countries in Africa that have the highest burden of unregistered children, and those are the Democratic Republic of Congo, Nigeria, and Ethiopia. We also know that in Asia, there are 3 countries that really are critical, and those are India, Pakistan, and Bangladesh. So we have 6 countries that have the highest burden globally. And if we can shift the needle in these countries, we can really progress towards universal birth registration. And the good news is, yes, we know what strategies work and what we need to be doing and what is cost effective. So the first strategy, which I already mentioned previously, is interoperability with other sectors and twinning, in particular with the health sector. As I said before, register the child where it is born in the health facility and ensure that the child can leave the health facility with a birth certificate in hand. That would be the ideal scenario. So we are working in over almost 80 countries around the globe to enhance these efforts and to really partner very closely with the ministries of health and working hand in hand with the civil registrar to really enhance interoperability. So many states, we recommend that states first look at their business processes before engaging in any digital tools to support those processes, and that they simplify those processes. So for example, if a mother or a father has to repeatedly return to the civil registrar office to first register the child, then to go back to pick up the birth certificate, etc., those steps complicate the process, right? So we have to simplify that process, and ideally enhancing interoperability with other sectors, especially the health sector, have proven to be real game changers in this respect. So register the child where it is born, and ideally ensure that the parents can leave the health facility with birth certificate in hand, sort of the one-stop approach, what we call interoperability or twinning with the health sector. We have seen, and then using the technology, the digitization, digital tools to relay the data that has been the registration that has occurred within the health facility back to the database of the civil registrar. This would be, of course, an ideal scenario, which would ensure that more children get their birth certificate immediately at birth and immediately after birth, and that cuts the business processes and it makes it easier for parents to obtain a birth certificate. The other opportunities are twinning with the education sector. So especially for children who were never registered at birth, these are important, what we consider important entry points. So when the children come of school age and they are supposed to register to attend school, usually in many countries there is a prerequisite that the child or the parents show the birth certificate. And in many cases, children are denied access to education because they cannot show a birth certificate. So what we suggest to countries is, rather than making that an additional obstacle to obtaining legal identity, to turn that into an opportunity and give those parents an opportunity when they bring their child to school for the first day or two of school to say, here are the documents to be filled in, working hand in hand with the civil registrar so that you can register your child. And in this way, we can catch up, so to say, on the backlog of unregistered children. Another opportunity is working hand in hand with social protection, especially in countries where there are cash benefits for family. That may be also another opportunity when these families, which are usually vulnerable families, apply for cash benefits or receive the cash benefits. That can again be a moment where we can try to catch up and register the children who have not been registered. So rather than presenting barriers, we try to present opportunities. So the interoperability and the twinning across sectors. Another key strategy that works, and that is very critical, for which we advocate for, is to get rid of fees, any fees related to birth registration and obtaining a birth certificate. We also want to get rid of fees for late or delayed birth registration. And we also advocate for countries to have the birth certificate, the first birth certificate, issued free of charge. So we think, eliminating all the costs associated with birth registration and certification would help a lot of especially vulnerable groups to register their children. Another key strategy, which is very important, is demand creation. We put a lot of effort through our programs, through our advocacy at the national level to ensure that in particular communities where birth registration rates may be low are informed about the benefits of birth registration and obtaining a birth certificate, so that they themselves as rights holders claim that right and understand how important it is for children to have a birth certificate and to be registered at birth, because it opens the door for their children to access healthcare services, education services, and other benefits that where there's usually a prerequisite to be registered at birth and to demonstrate a birth certificate.